Hi everyone, thanks for tuning into Community Health Matters. I'm Amy Marsalis, and today we're starting our program talking with Dr. Michael Warren, who is a board-certified pediatrician now with the Tennessee Department of Health. We're going to be talking about human papillomavirus in just a moment, but first we're talking about population health, which is a phrase, a term I had never heard of before. Would you elaborate on what that entails?
Sure. Folks have talked about population health for a long time. If you go back and look in the medical literature, there are descriptions there. But recently, as we're trying to think about how do we improve the health of people in Tennessee, we've got a renewed focus on this notion of population health. And the distinction is, if we think about the way that most people encounter health, it's through health care. So you go and see your doctor or your nurse and you have an individual encounter. In public health, we're really thinking about the entire population. So for Tennessee, that's about 6.5 million folks. And thinking about what are the main determinants of how healthy they are and what are the things that we can do to improve their health. And not just that 6.5 million people as a whole, but what about people in East Tennessee and West Tennessee and Middle Tennessee? Very different health pictures, very different landscapes, and where there are opportunities to improve their health.
There could be environmental factors, other things that have such an impact on their health.
Absolutely. So when I was in clinical practice, I might get 15 or 20 minutes with a patient, and I would say things like, you need to be more active or you need to eat healthier foods. And from a population health perspective, we might say, we need to increase physical activity. Are there sidewalks in your neighborhood? What's crime like? Is it safe for you to be out? And really engage those community partners around making that community a healthier place for people to live.
A broader view, which is vital.
Absolutely, and the healthcare is critical. We are fortunate to have phenomenal healthcare in Tennessee, and I would also say to make people healthier, it's bigger than just healthcare.
All right, moving along to HPV, human papillomavirus. We know it's pretty common. Let's jump right in. How is this virus spread?
So when we talk about human papillomavirus, most people have probably heard the papilloma part of that means warts, and that's where most people have probably heard of this term. And it's actually about 150 different viruses. Some of them don't cause many symptoms at all. Some of them can cause very distressing symptoms like genital warts, and that's where most folks have heard of it. Some folks can actually get cancer from certain types of the virus, and so that's why there's really a great interest in thinking about how we prevent it. To your question about how it's transmitted, most frequently it's through intimate contact, so intimate partner contact like sexual contact.
Are you seeing that in the younger population more so than the middle-aged population?
So you can actually see it across all ranges. In fact, most adults have been exposed, most adults who are sexually active have been exposed to the virus at some point throughout their life. But certainly we know that once people become sexually active, there is a risk for contracting HPV because it is so common. And so as we think about how to prevent HPV and the complications that come from that, we really want to focus before people become sexually active at all.
All right, I know we're going to get to that in a second, but let's talk again about symptoms, signs. Are they always really obvious?
They're not, unfortunately, and that's one of the challenges. Many people may be infected and not even know, and so if they're infected and aren't aware, they could spread that to their partner without their knowledge. Some people do have very obvious signs. So for example, the one that is probably most distressing to folks would be something like genital warts. You can also see changes in the cervix, and so a woman might have that identified when she goes in for a pap smear, and they might see an abnormality. But again, that may even be not obvious unless she's having other symptoms that go along with it.
Okay, that dovetails right into diagnosis of this. So that would be a pap smear?
So it depends on the particular type of virus, but a pap smear certainly for cervical changes. For individuals who have genital warts, that's something you would identify on physical exam, and so you would see those and be able to identify them that way. But there are other types of cancer that can be caused by HPV, and there aren't really good tests for those until the person becomes symptomatic. And so as you're working that person up for whatever symptoms they have, you might uncover HPV as the underlying cause.
Are there good treatments for this?
For some aspects, so there's not a treatment for the virus itself, but for example, you can treat the genital warts. If there's an abnormality found on the pap smear, there's certain procedures that can be done to address cervical changes. And certainly if an individual has cancer, there are treatments that are available. There's a variety of ones and a variety of effectiveness as you look at those.
Are those oral meds? Are they topical kind of treatments, ointments, things like that? Or is it an oral medication? What are some of those things? things?
So it can vary, again, depending on the way that the virus is presenting. If you think about something like genital warts, you might be talking about a topical treatment, maybe even a removal of those. If you're thinking about changes in the cervix, maybe a minor surgical procedure where that part of the cervix is removed or treatment is applied there. Certainly, if you're thinking about other types of cancer, it's going to depend on where that cancer is located and whether it's spread. So it might be chemotherapy, might be radiation, surgery, might be a combination of any of those.
What percentage of these cases goes on to present itself as cancer? Have you measured that? Is there a number out there?
So it's hard to know an exact number. And so again, we always want to know that there's a chance of this virus leading to cancer. And so we want to think about, again, moving upstream and trying to prevent it before it ever happens.
How can you do that? How do you prevent?
Great question. You know, in public health, we often think about prevention. We think about things like vaccines. How do we prevent disease before it ever happens? That really is the ultimate goal. And so if we think about preventing HPV, first and foremost, there's a vaccine, a wonderfully effective vaccine, very safe, and you can get that, both boys and girls, starting at the age of 11 or 12. And so as kids are coming in, that's about the same time. Typically, you're 6th or 7th grade, you're getting other shots like your Tdap, so for tetanus and whooping cough, you're getting a meningitis shot at that visit. This vaccine is just one more of those vaccines that you get. So it's part of that routine package of vaccinations that we give kids. It's still relatively new, so you and I didn't get it when we were growing up, but kids now get it, and it's just part of the bundle that they get.
Do many parents resist it? I remember in the past hearing that buzz about, well, I don't know if I want my kids to get that vaccine. Why wouldn't they?
There is some resistance. There's actually some concern among some parents that if my child gets this vaccine, maybe they're going to be more likely to be sexually active or sexually active early. There's actually been good studies that have been done to show that's just not the case. And what we know, in fact, is that kids don't start having sex earlier, but they also get that prevention. And so since this vaccine has been in place, we've seen a decrease in the number of cases of HPV and the types of cancers that are caused by HPV. So tremendous, and we think about it as a cancer prevention vaccine.
All right, very interesting. Thank you so much for enlightening us for this time here with us today. Dr. Michael Warren with the Tennessee Department of Health. We appreciate it.
Great, thank you.
All right, and we'll be right back with more after this.